Hello, you're live with me, Mariam Mashiri. The Ugandan Health Ministry has confirmed an Ebola patient has died in hospital in the country's capital, Kampala. He was the 19th victim of the current outbreak, which started in the Mubende district in the East African nation in September, and the first to die in the capital. Well, there have been 54 cases confirmed in the country, and 20 people have recovered, including these 5 medics who were discharged from hospital on Tuesday. Well, let's cross live to Kampala now. Patience Atuheira is our correspondent there. And Patience, first of all, we've seen the first dead confirmed in the capital, but how concerned are officials right now?
There is quite some tangible amount of concern because Kampala is classified from the very beginning of the outbreak as a high-risk area. This is because it's a huge city. There is a lot of movement between Kampala and rural areas. And because there haven't been any quarantines or lockdowns, there is some concern. But what the health officials have continued to tell us and to tell the public is that Uganda has been here before. Uganda has handled such outbreaks before, some of them even bigger. And there is no reason to panic. There is no reason to fear. They will get it under control.
Is there an indication, though, whether they will see wider quarantine measures being implemented?
I doubt that because President Yoweri Museveni spoke to the nation a few weeks ago and assured Ugandans that there won't be lockdowns or quarantines, even in Mubende in the central to western region, which is the epicenter, because the country is just recovering from the coronavirus pandemic. People lost jobs and work and incomes. So the president reasoned that another quarantine would break people. It would break families. People would lose work and income. And there is at the moment, because Ebola is not airborne and it is transmitted through contact, so there was reasoning from the government that there is no reason or need for quarantines.
So given all that you've been saying, what's the mood like right now?
People in the city are generally carrying on with their work. There is a bit of fear when you speak to people via social media or just small discussions. The local authorities at the epicenter in Mubende are saying that they have little resources to work with, and because there is still movement, that worries them. But generally, people are carrying on with their work. There is, of course, scares that you see being shared. Some of them are fake news that you see being shared. Another person has died, another person is infected, that sort of thing. But generally around the city and around the country, people are just carrying on and hoping that this outbreak will be controlled.
Patience, thank you.